Hello, here we are once again. We want to thank you for tuning in. This is Let's Talk Radio with Robert Vaughn, Mike Shomo, and Burl Majid. Today, we're going to revisit with a special guest that we had on back in February. It's Dr. Anisha Shomo. I'd like to introduce to some and present to others. Dr. Shomo is a board certified physician, family medicine physician, the director of the Family Medicine Scholars Program at the University of Cincinnati College of Medicine. She's a graduate of Shaw High School in East Cleveland. And I have mixed feelings about Shaw because they used to beat us in football all the time, but that was a long time ago. But anyway, she's also earned a Bachelor of Arts in Spanish and Doctor of Medicine degree from The Ohio State University. She has a moniker, show Dr. Shomo Knows, where she educates people regarding health information. I have her book, a signed copy I might add, called Health is Love, and you can get a copy at Dr. Shomo Knows at gmail.com if you're interested. Dr. Shomo also is the president of the Cincinnati Medical Association. She is part of the first all-woman executive board, along with Dr. Lane as secretary, Dr. Dixon as a treasurer. The Cincinnati Medical Association was founded in 1925 and is a local branch of the National Medical Association, which was founded in 1895. The mission is to support the delivery of quality medical care to the traditionally underserved segments of the greater Cincinnati community, to serve as an advocate for the underrepresented populations of the tri-state region, and to enhance the professional practice of the minority physicians. Now, I think Dr. Shomo has assumed this position, and she's placed in the position she is at a very important time. With the coronavirus, probably one of the most important things that we need is education, because I think we hear all kinds of things. I mean, I heard, first I heard Black people couldn't get it because of melanin. And then I heard that there were only 5 cases in the United States. It was nothing to worry about. And then I heard that, when the summer comes, it can't survive over 70 degrees, so the heat will kill it. So you hear all kinds of things. But what we like to do is, we like to bring someone in who actually knows what the real deal is. And I think it's important to get qualified information. So without further hesitation, I'm going to let Mike lead off. Mike, with a question for Dr. Shomo.
Yes, welcome, Dr. Shomo. We'd like to know, the program that was taken over by the Biden administration had no direction and had no kind of plan to do anything. At this stage in the game where he's ahead of what he promised, how is the medical field or the personnel and the doctors and nurses and anybody in the medical field, how are they responding to what the president is doing now?
Well, so it was kind of it was a mess with the rollout. I mean, the biggest issue was that there was not any funding. So, it's one thing to have scientists who do their job every day working on vaccines, and that obviously is an important piece, but the distribution of that vaccine is a whole other ballgame. And so the issue was that, there just wasn't a production, there wasn't a supply. And then different countries took different approaches. Like in the UK, they just gave everybody one dose. They tried to just prioritize everybody getting at least one dose instead of the approach that we took in the US, where we wanted to make sure everybody completed their series. So they went back, and once they had the supply, they went and gave people their second dose. So I'm not sure if that would have changed anything in the U.S. To make sure to prioritize that we make sure that everybody got their second doses. So there's just different approaches, but the biggest thing is it's just hard. It's just hard to we don't have an infrastructure. So the biggest thing about the healthcare system in the U.S. is we don't have a national public, like we don't have what they have in the UK and a lot of other countries. As big as this country is and as much money we don't have a public health system. So I worked for the Cincinnati Health Department for 6 years, and it was kind of like this makeshift city budget that we had to do primary care. So we have 6 primary care clinics, and we also had a network of school-based clinics. all funded by all funded by pretty much no funding. Like we funded by the city budget. I don't remember how much money we got from the city budget. But the school-based health didn't even have money. I had to leave the program because they didn't have money to pay my salary. So, we have all of these great public health things we could be doing, but there's no funding for any of it. So, they had to go. So I can't remember when it happened. I feel like they didn't get the funding approved until like March because I was in Haiti when it got approved. So they didn't get the funding approved to even do anything about this until March. So it's been only probably like 6 weeks since we've even had the funding to do anything
Well,
to mobilize people.
I'm glad that you mentioned Haiti. How are they handling the pandemic?
They really haven't had it as bad as here. Probably because people don't really move in and out of Haiti. They have a lot of political problems that kind of keeps them isolated. So they didn't really have as much of an issue with it as we did in the U.S. because they just didn't have people moving in and out like that. So fortunately, when I went there, of course we all wore a mask and everything, but it just wasn't as much of an issue.
Okay. Verl?
Would you say that, speaking of Haiti, first, thank you for joining us, Dr. Shomo.
Thank you for having me. I didn't get to say that.
Okay.
Thanks for having me back.
Yeah. Thanks for coming back.
Love to have you back. Would you say the situation in Haiti is contained, or they've reached herd immunity?
I don't know that they reach herd immunity. The biggest thing about a place like Haiti, so I'll talk about the U.S. not having any public health system, but at least we have some kind of health system. In Haiti, they don't have really a public health system at all. So there's really no way to know the prevalence. Because the way that they do healthcare here, and the way they do everything really in the United States is everything is managed by the state, which the state usually delegates to the counties, all that sort of thing. So everything is really kind of, little by little piecemeal. But in Haiti, they don't even have that kind of infrastructure. So they have a national hospital called Mirabale, and that's pretty much the only public hospital they have in the whole country. And it's not that big of a country, but it's so mountainous and the roads are so bad, and the traffic can be kind of rough depending on what's going on. And it's an interesting place. so they just don't have an infrastructure at all to even like test people to see what the prevalence of the vaccine of the virus. So it's just really hard they don't have the kind of data that we have. Even though like I feel like our data isn't the best data, we still have a lot of data that Haiti doesn't have any kind of data like that.
What do you go to Haiti for?
So I usually go there to work. So I actually manage. I usually lead like a coordinated team. So we have 2 different teams that go. They actually go 3 different times a year, but the 2 biggest teams are in March and in June. So I usually or like end of February, March, usually around Mardi Gras. So I usually coordinate the Mardi Gras team, and then there's another team that goes in June. So I'm usually there doing primary care. I usually take residents, other doctors with me to help with patient visits. We do a lot of consults, and then there's surgeons who come and do surgery. So at times we'll do hernia surgeries. There's an ophthalmologist who's amazing, and so we will do eye surgery. So really, that was our primary reason for going, because people are blind. People will have really bad cataracts to the point where they're blind. And so it's one thing, they always have primary care doctors there to do medications and all that sort of thing. But, there's only Dr. Anika Michael who goes and helps people not be blind. So we were trying to go, and I usually try to support Dr. Michael, because people's blood pressures are very high there. So she can't do the surgery if their blood pressures are high. So I'm generally in charge of doing her pre-ops. And then of course I do whatever else.
Is that a part of an organization or?
Yeah, so I should say that. So thanks, Dad. The organization is
Dr.
called
Shomo?
AHDH. So
Yeah, oh, pardon me. Dr. Shomo, I had a question for you.
Yes.
I'm probably the only one on this panel who has not taken the shot.
Okay.
I'm pretty sure Robert and Mike have, and I'm pretty sure you have too.
Yes.
But my question was, do you think there was really enough discussion? I mean, when they came out, it was like Dr. Fauci, he was just like the narrative for the government. It's like there's other doctors, credible doctors I've seen through some research and online, and they're just taking a different position on this virus. And I know there is some fake news and conspiracy theories
Right.
all wound into this as well. But do you think there was enough discussion among, you know, doctors who, you know, were well recognized, you know, and had, you know, like peer review and all this stuff, you know? Do you think there was enough discussion?
I think that I think that um, there were a lot of opportunities for us to get educated. So there were, I don't know what you mean by discussion. So in Cincinnati, we actually have town halls where doctors have been available to answer questions in our community online. We do it on Facebook. So there's an organization here in Cincinnati that's dedicated to addressing health disparities called the Center for Closing the Health Gap. And so they have been hosting town halls since, I don't know, feel like maybe last June. So for the past almost year, they've been having town halls just about COVID and, you know, what you can do to protect yourself and all that sort of thing. But as far as, you know, the medical community coming together and having a lot of forums and that sort of thing, it's a pandemic. So it's not, it's not like we could have had like a bunch of conferences and that sort of thing about it. But I do know that um, a lot of doctors did have a lot of opportunities to educate themselves and read the article. So I'm trying to think, the first data that came out, so I think that was hard is that like, as soon as the data came out, they started vaccinating people, right? So is that what you mean? Like there was really not a lot of time in between that?
Yeah, I mean, yeah, discussion as well as testing, you know, because this vaccine came out pretty fast, you know. I mean, we're in a pandemic, so I guess people wanted some results fairly quick, but
I mean, it's an emergency situation, but I think that the vaccine seemed like it came out faster than it did. The vaccine has been in the works for, they've been doing this mRNA work for like 30 years. But the actual trials for the vaccine for coronavirus started last February. So it
okay.
seemed like it came out really fast, but it had actually been in the process for like 10 months. So that's the whole thing. That's what's really weird is that people will be like, last February, we didn't even know about coronavirus last February, which we didn't. But the scientists knew. They knew what was going on in China. There was a lot of collaboration.
Oh, okay.
I talked with someone, I can't remember who it was, but you know, I know my dad used to always tell me, he said, son, he said, in life, you always want to play the odds, you know, you want to do what's in your favor.
Right.
You know, if there's a 9 in 1 chance you'll be successful, that's what you want to do rather than a 1 in 9 chance.
Right.
And I think, I forgot who it was, somebody said they talked to someone who had 10 family members die from the coronavirus.
Yeah.
And I would just ask, was it worth it if they had taken the shot?
Yeah.
Would it have been worth it if they had taken the vaccine?
Yeah, to not lose 10 family members.
Well, you know, I heard that when
You know?
what they were doing.
Mhm.
I talked to I consulted with another doctor, not Dr. Shomo, but when I heard it, you know, she kind of like said the same thing. But another doctor had told me that they had worked on. They were actually looking for things to a vaccination for the AIDS virus and any other viruses that were there. So what they did was when they looked around and kind of like put feelers out to say who was working on this, who was working on that, what can we do, and brought it up. In fact, they were saying there was quite a few minority doctors and scientists that were involved in this that had these already, and then they, you know, said, well, this is how we're going to do it, and then they gave it to the pharmaceuticals companies.
Right.
That sold it to them or something like that.
Well, no, it's basically just the thing is this all really did happen fast. It's usually a 2-year process. So it happened in about a little less than a year, which is unprecedented. But it's unprecedented because because of the Human Genome Project. So the Human Genome Project happened in the late 90s. So we've been working on a lot of different vaccines. And that's the whole thing that a lot of people don't understand is like, scientists literally live for this day. Like they don't want to see all these people die, but if you stay ready, you don't have to get ready. So that's the whole thing. Like, you know, there've been people in the background working on a lot of things. And so because of a lot of those, you know, systems and processes that we had, things were able to move a lot fast. You know, we got the internet, we got all this sort of things that we can share information a lot faster. So I think that's, you know, like I tell people, I graduated medical school in 2010. I tell my medical students that. I'm like, I graduated medical school in 2010. Do you know that I didn't have an iPhone the whole time I was in medical school? Like 10 years ago was not a long time ago, but there was no such thing as an iPhone, you know? So I think that people
there was a
forget that.
BlackBerry. I bet you had a BlackBerry.
I probably had like a flip phone or something. You know what I mean? But I'm just saying that like 10 years ago, like, technology has just changed so fast. So when people are like,
Well,
oh my God, they brought out
yeah,
a vaccine in 10 months, it's just like
yeah.
10
Well, I
months,
think the
20 years ago, you know what I
yeah.
mean? It's just a different, it's just a different ball game.
Well, I think the whole technique with mRNA is a different type of vaccine,
Hmm.
the messenger RNA,
Right,
where you don't actually have to use a live virus where it's
right,
been deactivated. You can actually take a piece because of CRISPR, because
right,
of gene editing technology
right,
that wasn't available 10 years ago.
right,
You can take a portion of a strand of RNA
right,
and put it on another strand of RNA, and it kind of fools the body into thinking it's being invaded. And that's how you develop antibodies. Is
right.
that correct?
Yeah, I explained it kind of like a bouncer. Like,
Uh,
your antibodies are like bouncers. And
mhm.
if you got a picture on the wall of somebody who's not welcome in that club, you the bouncers will see that. And so
And throw them out. Okay.
that's kind of what the vaccine does with the messenger RNA. It sends a message like, if you see this,
Mhm.
get it out of the club immediately. So that's kind of how I explain it.
So it's a relatively new
Yeah,
technology, all
it
right?
is.
Yeah.
Yes, but it's been around for about 30 years.
30 years has. Oh, okay. I
Yeah.
didn't know that. Okay. Okay.
Yeah, it's been around for a long time.
No.
The thing that I've noticed is, and people were, finally getting the vaccine up until the J&J blunder.
Right.
I think, you know, what do you feel that what they can do to restore the faith in the vaccine, because that made it take a hit.
Right. Yeah. I think that the numbers have definitely been down since then. But I think that for me, I think we just have to keep having the messaging out there. I think there's two different things. So it's part of J&J, but it's part that the death numbers have been down. But the actual coronavirus numbers are going up. So I think that message that, we're out of the pandemic, we don't need the vaccine. I think that's it was like both of them happened at the same time, where the death numbers have been going down, and then at the same time the J&J, situation happened. So I think it's kind of both things. But as far as the Johnson and Johnson, I did the math, right? So, unfortunately, there were a few people who died from that, which is never good. But there've been, almost 600,000 people who have died from coronavirus. So that's the kind of the thing that, it's kind of it's hard because we talk about a risk benefit game. So I don't want to see 3 people die from a vaccine, but I also don't want to see 600,000 people die from a virus. So I think that, that's what's hard for people to really kind of put into perspective. And I think it's just a numbers game, and trying to help people really understand that this is an emergency situation and we're trying to get out of.
Mhm.
And of course, we don't want to have people have side effects. And they put a warning on the vaccine now, where they're only giving it to, I think, 50-year-old men and up. So they did kind of come back and do that. And I think that just gives people pause of like, well, they don't really know and that sort of thing. And that's what's just been really hard about this whole thing. Like, there's a lot of things that we don't know. But we do know that the coronavirus has killed over 600,000 people. So there are some things that we're still trying to iron out, as far as like, are we going to need another vaccine? What's that going to be like? There are some things that we're still learning as we go, um, because it's just an unprecedented time. Um, so I think that for Johnson and Johnson, a lot of people have just been giving the Pfizer and Moderna, because we've been doing that for almost 6 months now, and there haven't been any issues.
Well, there was so much promise for the J&J because it was a one-shot thing.
Yeah, it was a one dose.
And then, was it Pfizer just came out a couple of months ago, or within the last couple of months, and they were talking about getting boosters in about another year or two.
Right. Yeah, I mean, that's one of the things that people are talking about now is, are we going to have a fall booster for the variants that are there, the mutants, the variants. So it's possible, and that's what I'm saying. Like, there are a lot of things that we're trying to figure out, and I think that's what's been really hard about, why some people are hesitant. They're like, well, we don't know everything that's going on. It's just like, we're not going to know everything that's going on. We're going to know what we know, and we're going to try to do our best to keep people safe. and um, you know, trial things and put out warnings if we need to, all those sort of things. So, and I think that's just what's hard about this time is like people feel like, well, I don't want to I don't want to get the vaccine and then, you know, put myself at risk, but it's like you're already at risk. You're already at risk.
Yeah.
600,000 people have died. So I think that's, and then it's like there's 600,000 people who have almost 600,000 people who have died. The death rates have definitely slowed down since the vaccines rolled out. Like I wrote a letter, I feel like in February about the death rate being like 550,000. So since then, in the past 2 months or so, we've had way less deaths. So the vaccines are definitely working.
Mhm.
But there's still a lot of people who are getting coronavirus, and then we worry about. There's been kids who've been hospitalized
Mhm.
because of different effects that they're having. So a lot right now, it's a lot of young people who are being affected.
Yeah.
So the biggest thing about it is like people will be like, "Well, I'll just take my chances," but the coronavirus is way more dangerous than any vaccine.
Yeah.
I mean, that's the whole point of
Also, yeah, also, I know somebody personally who had it, and him and his wife had it there in Detroit, relatives of
Yeah.
mine, and they had it pretty bad. I guess
Yeah.
and they didn't go to the hospital. They told them at the time just stay home and stay away from
Right.
people. And his mind still, you know, there's still some
Right.
issues.
Yeah,
Uh,
there's been a lot of
you
like
know, and
COVID dementia,
COVID,
COVID-related
yeah, yeah,
cognitive
yeah,
effects,
yeah,
the
and
lungs. One of my friends had a stroke. One of my friends had a stroke. You know, at my age. So there's
mhm,
been people my age who've died. So I think that a lot of times people are just like, you know, well, I can sit on the sidelines and see what happens, but it's like that's not what you want to do because
right,
there's
right,
plenty of
right,
people who
right,
are
right.
still, you know, they talk about the deaths, but they don't talk about what people are living with. People are
Yeah,
living with
and it could take
chronic
a
diseases.
while. It takes
Yeah,
a while to come back from some of those symptoms. You know, it's like
right,
I know back in high school, people would have mononucleosis, you know,
right.
and then they would have this, what do they call it now? Where you're tired for like
Yeah, like
6
fatigue,
months.
like
Yeah,
post-viral fatigue.
yes,
Yeah,
fatigue. Yeah, post-viral
yeah,
fatigue. And they
yeah,
would have that for like, they wouldn't be sick anymore, you know, but they'd have that for like 6 months, a year later. So
right.
is it something similar, you know, with even
Yeah,
when you beat the virus, you could still have some after effects that could stick
right.
with you for a while. Huh?
Well, you know, I
Yeah, it's like, but and the other thing is just it attacks so many things. It can attack the brain, the heart, the lungs, the kidneys.
Mhm,
Like I know somebody in their 20s who had not, I don't really talk about my own patients,
mhm.
but I just know of somebody who had it in their 20s and had kidney disease. You know, what I mean, it's just like it attacks so many different things, and I feel like that's part of the conversation. It's like we talk about the deaths all the time, but we don't talk about what people are living with.
So if you get it and
well,
get rid of it and you don't have any repercussions, you should consider yourself lucky.
Right.
You're pretty lucky. Yeah. Go ahead, Mike.
I
You were going
I,
to say
I believe that me and my wife had it back in 2019 because all these symptoms that you know the low grade fever, you know we had the bad cough, just everything in there.
same thing with me and my wife back in
Yeah,
November
right.
2019, Thanksgiving.
In fact, I was done with it because I guess maybe it's because I took a flu shot and my wife didn't, but she didn't get rid of it until March. And in March, we knew what it was. But just when when I was up in Buffalo, I had got transferred and I was moving back to Cleveland in 2020, and I was getting ready to leave, and all of a sudden my brain got hot. It got hot, and I
Mhm.
passed out. And when she woke me up, and I just asked her, "Well, how long was I out?" But then those things kept coming on up until I got the vaccine. When I got the
Mhm.
vaccine, I haven't had a episode with that, but it was like I was having a mini stroke or something. You know, it
Hmm.
just getting I would pass out, I would fall down. But since I've had the vaccine, I haven't experienced none of that because I remember I was driving down to Cincinnati and it's just like I was disoriented. Like the road seemed like it just turned upside down, and
Hmm.
and I went to brake, and I was in the fast lane. I went to brake, and I was trying to navigate stuff because it was just like my equilibrium was all messed up.
Yeah.
But then I got I was okay, but that had a couple of episodes. I talked to my doctor about it, and he couldn't figure it out, and I was just saying after I had got the vaccine, I was saying I bet you that was the side effects from the
Hmm.
COVID that I
From the
had.
COVID. Yeah.
Yeah. because
So,
I've been all right since. I haven't even had a feeling
That's
about it.
good.
Yeah.
okay, Dr. Shomo, you remember when early on in this COVID thing when Tom Hanks and his wife had it?
Yeah.
And they were simply asked to quarantine for a couple months, and supposedly it went away. And I don't know if they've got a shot since then or anything. Do you think the virus has evolved or mutated or something?
Yeah, so there's been a lot of mutations and variants and that sort of thing. And that's what I'm saying that we might have to do a booster this fall. And that's the whole thing. Since our public health system is not the best, we haven't really even been testing. Like we don't even have the testing ability. Like when I test somebody for coronavirus, it just says coronavirus detected or not detected. But it doesn't give me a genotype of what type of coronavirus it is. So we haven't been very good about testing the different variants. And it's possible that they are behind the scenes. Like, I don't know. They could be testing behind the scenes, but they're just collecting data. So that's possible, but it would be nice if we have better data about the different types that we're seeing. But yeah, so definitely it has.
Vaccines are genotype specific too. Is that true or not?
Not generally. They try to. The thing is, with this particular vaccine, they attack the spike protein.
Mhm.
So it shouldn't matter that much
Genotype
because
should matter. Okay, okay.
yeah, it shouldn't matter that much because if you're going against a certain type of, because basically they train our body to recognize that protein. Like when you see this corona, because that's what the coronavirus looks like. You know what I mean? It has all those little spikes on it. So that's what the vaccine targeted. Like when you see these spikes, handle that, bounce them out of here. You know. So even if
Bouncing.
the genotypes change some, it shouldn't matter too much. But
Okay.
I think that's part of why they're doing a lot of research behind the scenes and trying to see if we're going to need a booster. One of my colleagues here in Cincinnati was a part of the trial. So
Okay.
Cincinnati was a part of the trials, was one of the trial sites for Moderna. And so I have a couple of colleagues who are part of it, and it's still ongoing. So they're still testing to see if they still have antibodies and see if they're still protected. So they joined the trial, I feel like in either September or March, and they still have antibodies. So I think that's one of the biggest things is people didn't know how long the antibodies would last. So I think that'll be the biggest, and that's the other thing too. Like when you like get corona virus, what is your natural immunity? How long does it last? It lasts about 3 months, is what we know. So the vaccine definitely lasts way longer than that. It lasts, like I said, it
Dr.
lasts at least 6 months.
Dr. Shomo, I just want to, you say our health system, you say it's not good, but is there anything we can compare that with as
You
opposed
compare
to?
it to Canada. I mean, is about like as big and spread out as we are,
Okay,
but they just have a better response because we don't have a national we don't have a national health system. So the closest thing that we have to that is like the VA system. So you look at the VA, they have different sites in multiple states and that sort of thing. It's all ran by the VA. We don't have anything like that for outpatients. So you know everything is still insurance based. So if you don't have insurance, then people cannot have access to testing. If you don't have insurance, you cannot have access to treatments. If you don't have insurance, people get worried about whether or not they get the vaccine. So just to clarify that, you can get the vaccine even without insurance. So the vaccine, this is a health crisis. So the government has already purchased all of the vaccines, and their job is to get them to you because our economy is terrible right now. So they have a vested interest in people getting vaccinated. So you don't have to worry about having vaccine insurance in order to get the vaccine.
So if you don't have an insurance card, you don't need one.
No, you can
Go
still get
and
the
you get the
vaccine.
vaccine. Okay.
Yeah.
but if you have one, they can send it to your
Right.
health
Charging.
provider.
Oh, okay.
Yeah,
That's
and
like,
it's usually more that they'll bill you for the administration. Like they usually, like if I give somebody a vaccine in my office, we usually get a $15 fee for just having it in our office, that sort of thing. So there's a fee that they can bill your insurance for, but I don't think they actually bill their insurance for the actual vaccine.
Oh, okay.
But yeah,
Another-
so working in Cincinnati, I worked for an FUH. So when I worked for the city of Cincinnati, we had 6 clinics and we were able to get FQHC status. So FQHC stands for Federally Qualified Health Center. So what the government here does is they have different health centers throughout the country. They basically can see people without insurance and people who have Medicaid, because a lot of doctors don't take Medicaid. So we have somewhat of what we call like underserved, like a safety net for people who don't have insurance, who can't afford insurance. So we have Medicaid, and we have Medicare for people who are retired or disabled. So we have those two programs in the U.S. where people can get access, but not everybody takes it. So
Okay.
the government then, on top of offering that kind of insurance, they have specific sites where people can go and get care. So there are all these different networks throughout the country that provide that service, but they're all run individually. So there's no coordination, there's no meetings, you know what I mean? Like there's no federal administration of it. There's not even local administration of them. It's like whatever that FQHC network is that whatever that FQH network is, and their policies can all be different. Their management can be run completely different. So when I'm talking about like in Canada, they have an actual network that's run by the government that's in different places, and doctors are assigned to different people. And they can give education, like they have community health workers. So it's just like we have like, just like everything else in the US, everything is very piecemeal and it's inefficient. Also, it costs more money to do all of that and generally not have the best results. So
And the thing with a virus too, if your state is good about wearing masks
right,
and you vaccinate, it doesn't matter if the state next to you is
right,
just the opposite,
right,
because this has to be cured worldwide.
right,
Because if it's not, then someone in a small country that didn't get the vaccine could come here and just start it up all over again.
right.
Would
Yeah,
you agree?
exactly.
That's why it's a pandemic.
Right,
Yeah,
exactly.
yeah.
Yeah,
That's why it's a pandemic.
Right.
Okay.
Once it crossed continents and stuff, it's a pandemic.
It's a
right.
pandemic.
You
That
said
would have been an
that-
epidemic.
Yeah,
Epidemic.
yeah, because when they first were talking about it back in January, because it was Trump say, "Oh, that's something that the Democrats made up and this, that, and the other," but it was already a pandemic then because it had crossed continents already.
Right.
Right. Okay. Okay.
Yeah.
Now compare. You were here before about 3 months ago,
Yes.
and we really want to thank you, because after your appearance, we all of us had many people reach out to us and said, you know what, I wasn't going to take the vaccine, but after hearing somebody other than you, the three wise men, I decided to go ahead and take it. Compare where we were then to where we are now, and give us a grade. How are we doing as a country? Since Biden got in terms of compliance, we still have a lot of issues, I know, but
We still
have
have
we
a
made
lot.
significant progress? Would you say?
Yeah.
Mhm.
I would say we have a lot more people vaccinated. So the most recent data that I've seen in Ohio, and that's the thing, I don't know like county specific. So that's what I'm saying. Everything in the US is just like state by state, county by county, So it's just an interesting way to do things.
That is, yeah.
But as far as the Ohio data that we have from the ODH, the Ohio Department of Health,
Mhm.
In Ohio, 38% of people are fully vaccinated. And then 22% of African Americans are vaccinated. So that's kind of where there's a little bit of a lag of, we're lagging behind in the Black community with people getting vaccinated versus just in the state in general. So I would say that we definitely have more vaccines, we definitely have more availability, but we still have a lot of mistrust. Still a lot of people are very wary about, just a lot of different things, a lot of concerns about the vaccine. But
Right.
it's just one of those things where it's like, it's kind of one of those things of like, you have to, I think we just have never experienced something like this before. So I understand why people are afraid, but I think
Right.
that people really underestimate the risk of coronavirus.
Mhm.
They're not afraid of dying, huh?
Right. Yeah. It's like,
Yeah, yeah.
people are more afraid of what could happen with the vaccine and die from the vaccine
Right.
versus dying from coronavirus, which is way more like a way higher risk.
Uh-huh.
Because I did the numbers, like the Johnson & Johnson thing was definitely hard, and I feel very bad for the 3 people so far who had issues with it and passed away. But I
Mhm.
also understand that they were they were trying to do something. So it's one of those things where it's one thing to feel like, well, you try to do your best and it didn't work out, versus
Mhm.
a lot of people And I would say most of the people who died from coronavirus really weren't didn't have an option, so it's not really a fair comparison in that way.
Right.
But I think that that's what people are, that's really what we are. It's kind of like, you have the option to do nothing and wait it out, or to take the best chance that you have and get the vaccine, because it's really a numbers game. And I think that people don't really understand it in that way, because like when I ran the numbers, like 7 million people. So last time, I think I did this like last week. So I ran the numbers because I deal in data, as a physician, like that's what we do. We deal in data and science, and science is data based. And of course, people always, the numbers are interesting that way. You can kind of manipulate them, but this is just simple algebra, like my dad says, just simple, not even algebra. It's just
general math.
It's general math. Yeah, it's general math. So that's what my dad always
thing.
says. Yeah, general math. So, there's 7 million people who got the vaccine. And I put in a number of people who even had that rare side effect from the Johnson & Johnson. It was 12 people altogether who were affected, as far as we know. So when you take the number 12 divided by 7 million.
It was that point 0.0000.
Yeah, it's like 1, 2, 3. It's 5 zeros and a 1 and a 7. So 0.00000171% chance that can happen. So it's very unlikely that will happen. I think that's kind of one of those things of like, people are like, oh goodness, but it's just like, it's highly unlikely that would happen to anybody. And it's very likely that people, like the death rate for coronavirus, last time I checked, was 1%. So I don't, like I said, because the vaccine has come out, it's probably different now. But initially, early on in the pandemic, when we didn't have a vaccine, the death rate was 1%. So we're talking about 1% of people who got coronavirus died, and we're talking about 0.000000017
of 1%.
Right.
Wow.
Yeah. So like a minuscule amount of people had that effect, and not all of them died. So there were 12 people who they were monitoring and that sort of thing. So the number of people who die is even lower than that. So it's a numbers game, and I think that people, like I said, people really don't. It's like people feel like they're more at risk of dying from the vaccine than the coronavirus, when that is absolutely false. And I think that people just don't understand that. They're like, I don't want to go get that vaccine because, they're not going to die. But it's like, well, if you don't get the vaccine, you have a higher chance of dying.
Yeah, more chances. Your chances increase.
Yeah.
Right.
Burl, did you want to chime in here?
Yeah. Dr. Shomo, one of the things that gave me pause about the vaccine was, you remember in 1976 when we had the swine flu outbreak? You were probably a baby back then.
I wasn't born.
Yeah, say please, please.
Anyway.
He wasn't born in 84.
A year
Was
old.
he born in 84?
I was born in 84, yeah.
Oh, okay, yeah. Well, that was
one of my sisters was born, just not me.
Oh, okay, I got you. It was so many girls, I get them mixed up.
Yeah.
But anyway, in 76, they had a big rollout, and the government was involved. They were on TV, and everybody's going to take it. It's going to be a pandemic. And you need this shot. You need this swine flu shot. And so consequently, when it happened, a lot of people got ill. There was a good number that died. Some people went blind. Some people went crippled. And the thing was supposed to be like an ongoing thing. But after 6 weeks, they canceled it,
Right.
So, I mean, just being old, I remember that, and I was working at an ABC affiliate in Cleveland at the time.
Right.
As a film editor. But
that's kind of what's happened with the Johnson & Johnson. I don't remember when it got approved, but it's not really been out that long. So that's what I'm saying. Like, I hate that, because the whole thing is, like I said, they have different phases. So they went through all the process, but the problem is it just depends on who was in the trial. So that's the problem with trials, is they go through the process, but if they didn't recruit a lot of young people in the trial, they wouldn't have known that in the trial. So when they wrote it out to the general public, that's what they found out. Like, oh, it's not good for young women, which is, devastating. But coronavirus is also not good for people either. So it's just kind of one of those things of, the reason why I got emergency approval was because we're dealing with an emergency situation. I think that that's what people don't really understand. Like, it happened fast because we have the technology, but it also happened fast because we're dealing with an emergency.
Mhm.
So,
Without the vaccine, just hypothetically, about how many people you think lives would have been lost if we
oh, I
had?
think we probably would have lost another 500,000 by now. I think we would be up to 1 million deaths now, because a lot of the deaths were happening in nursing homes. Like
Right.
that was just a big hotspot. But that was one of the things that they prioritized. So when the vaccine came out, they definitely prioritized the nursing homes. And like I have a chart of data, like it literally just like nosedived. Like the rates of coronavirus in the nursing homes and the rates of deaths from COVID in the nursing homes just completely just nosedived after that.
But
So
those were the initial hotspots, right? That
yeah,
started to spread in most communities, right?
yep.
Yeah.
So
Yeah.
that's that has really changed the game, because without that happening, we would be up to 1 million deaths.
Well,
We
hey,
were
well,
losing
Dr. Shomo,
we were losing like 100,000 people a month, more than 100,000 people a month.
Whew. Wow.
do you remember they were kind of pushing it for like older people? And then they
Yeah.
said the age range started coming down,
Yeah.
And I think now it was like the last thing I heard was like if you're 18 years old, you can take the virus, take the
Yeah.
vaccine.
The vaccine.
Mhm.
Yeah, had you heard about that?
Yeah. So I think
It's
it
like
was
what?
it was like March 29th, and it depends on your state. So in Ohio, they opened it up. So I don't know. I've been very fortunate that we live in Ohio during this whole pandemic, because when you're dealing with a piecemeal situation state by state, I feel like Ohio has done a pretty decent job of trying to get on top of things early.
And DeWine did a good
Schools.
job early on, don't you think?
Yeah, he did a good job early on,
What do
and
you think, bro?
I
Yeah.
feel like he's still doing a
bro.
fairly decent job where he's
Yeah.
done a lot to prioritize people, because like in Ohio he just said anybody who wants to get it can get it. I don't, and so I think that was a good thing for him to do, so that a lot of young people could have access to it.
Yeah,
But
he got a lot of pushback too from the businesses, but he kept them closed
from his own party.
until he thought things were starting to come down,
Yeah. Yeah.
Yeah.
I think
Well,
DeWine did an excellent job because see,
I do too.
even when it started to be, he had opened it up, then it started spiking again. He closed it back down. Where a
Yeah.
lot of the governors in other states, they were just like, well, we got it open, we're gonna leave it open, and those numbers shot up like crazy.
Right.
Yeah. And some of the states that left it open, such as Florida, don't really know what the numbers are.
Yeah.
Because they were discouraged from reporting all the cases.
Well,
Right.
My thing was all the time, because the old saying about the 6 degrees of separation is that the actual numbers is always six times higher than what it is.
Right. Exactly. Exactly. That's what I'm saying. We won't really ever know the numbers.
Right.
But the reported numbers, I feel like they would be double what they are. If the vaccine hadn't started rolling out in December, we would be at least 1 million deaths by now.
Now, do you
Because you
think
got to
we
think
missed?
about, like, it was snowballing. It was like every month, more deaths, more deaths, more deaths, because it's like, it's the exposure. Like this person got exposed, that person got exposed. So every time it was like, every time it's getting worse and worse and worse. It's like, triple, quadruple, sextuple the people.
Right.
So, it was kind of just really, really getting out of hand right when the vaccine rolled out. So it was really
because
good timing.
When people started realizing, well, when they test people and they had it,
Right.
It's like, well, who did you contact?
Right.
Who's this? And they have to trace back to find out, and then they find out those people. That's what I was talking about. It's six times higher because
Right.
6 degrees of separation. That
Right.
you done been with 6 other people already.
Right. Exactly.
Who've each been with 6 people? Who've each been with 6 people?
Right.
Right. Exactly. So it was just like exponentially growing every month, like just losing people and losing people and losing people. So I'm really grateful that the numbers have slowed down the past few months.
In fact, if you talk about back in '76 with the swine flu, if you remember, back from like 70 to about 74, 75, especially with the people coming back from Vietnam and stuff like that. And, they had an epidemic of STDs. Okay.
Yeah.
And then, when they found out, okay, you had an STD, you had to give them a list of who you've been with.
Yeah.
So that, because if that person been with 6 people, and then the other people been with 6 people, and it just goes on and on.
Right.
Yeah.
It's like that. I mean, and they've definitely compared this to like the AIDS epidemic of like when it first happened, how there was a lot of stigma about HIV and people didn't really know all the information, and there was just, there was a lot that went on. So there've been a lot of comparisons about coronavirus and HIV as far as, how people were trying to keep it hush hush. Nobody really wanted to talk about it.
Yeah, a lot of people
lot
still
of-
want to admit to having it. A lot of people
Yeah.
still want to admit to having it.
Yeah.
You know?
Hey,
Yeah.
Dr. Shomo, if a person has had it and let's say they take the vaccine or whatever, for whatever reason it's ran its course and they get tested, will it show up as a positive or a negative?
It takes a while for it to turn from positive back to negative. It can take a month or 2 months because early on they were having people get tested to go back to work, but they realized that it stays in the dead virus stays in your system like shedding for a while, even when it's not active. So they stopped doing that, and that's when they switched over to the symptom based instead of like the return to work testing.
I
So
know, I know
mhm.
when, like I said, I had it in 2019, and then just like, was it this year
Yeah.
and I had got it. I had gone to the hospital for something else, and they tested me and said I had coronavirus. And I was like, I didn't have no symptoms at all, which was good because I had it before. I don't know if it was still in my body from then, but
It probably wasn't. I mean, it's probably a new exposure. That's what I'm saying. It because after
yeah,
3 months, it's all gone. It's if you haven't been vaccinated after 3 months, it's all gone. So it takes a while, and I think that's why like it can shed for a while. So it's just
but
So,
it's
I
Dr.
kept telling
Shomo, do you
Dr.
think this is
Show,
an airborne virus?
is it
yeah,
airborne? I mean, yeah, that's why the masking helps because it's not necessarily. I mean, they're going back and forth about airborne, but it's definitely always been considered what's called droplet, which means in the saliva. Um, But as far as, because they had talked about once the masking was, working, that the virus was getting better at evading masks, which I don't mean if that means it figured out how to get smaller. I don't know what that means, but the viruses, they just trying to live, so they try to outsmart us, and I think that's what's been really hard about this virus is why people don't believe it's real. Like, how is a virus going to outsmart us? And I'm like, the Black Plague killed a lot of people in Europe, back in the day. So it's just one of those things where bacteria and viruses and parasites and all types of stuff really have the power to
yeah, the black
wipe
plague,
out millions of people like they did.
the black pig. I think they found it came from rats or something. Then when people, wasn't that the
Yeah,
one?
probably.
Yeah, it
I don't
came
remember
from
how
rats.
many people died, but it was like millions of
Yeah,
people
but
that
it
died.
wiped out a whole bunch of people in Europe.
That was a
I mean,
hoax.
and
It
then
was a
the
hoax, man.
and then
It was a hoax.
Yeah,
a hoax, yeah.
with
And
all,
then what was it? The Spanish flu and that's
yeah.
the thing. And the Spanish flu
Spanish flu
killed,
started in Oklahoma, didn't it?
I don't know, but it killed like 20 million people
Yeah, they called it
worldwide
the
or
Spanish
something
flu, but
ridiculous.
it actually started in Oklahoma on an army base.
Oh
You know
wow.
what's
What I've
crazy
read.
about these variants they talk about?
Mhm.
Have you noticed, like they say, okay, we got this variant coming from somewhere overseas,
From
and then all of a
Africa,
sudden, in the middle of the United States,
from
it
Europe.
pops up. You know,
Yeah, they
like
don't
Well,
really know.
I think people are people travel so much. I know I was before the coronavirus hit, I was in Las Vegas last year in February, last week of February.
Mhm.
And the thing that really I noticed was that every Asian person had on a mask, every single one, and none of the Americans had on a mask.
Well,
None.
they've been wearing masks in Asia for years.
I
Yeah,
know, but
that's what
see,
my
they
cousin
knew.
said.
But I asked this young guy who was by me. He said, and I said, well, why? We got to talk. He was 17 and he was coming over here to a basketball camp. And I said, well, why are you wearing a mask? He said, because there's a virus in my country. I said, where are you from? He said, I'm from China. He said, there's a virus in my country. And every time we have a virus, we wear masks so we can slow down the growth of the virus.
Right.
And I think it was the next week that's when it kind of blew up here. But
Yeah.
we had kind of known about it, But I thought,
Right.
I'm looking at the airport in Las Vegas. There's people from all over the world,
Right.
thousands of them that go through there every day.
It's
So if
crossing,
you
yeah.
got a virus in Bora Bora or Anchorage, Alaska, there's a good chance that it's going to get
Right.
spread there.
And
And one
that's
thing
what.
I wanted to ask you too, if masks should still be worn if you're around someone that's not in your immediate family. What's the scoop on that?
Um, so like I mean, I go to work every day. I've been vaccinated. All my coworkers have been vaccinated, but we still wear our masks because you just
Still
never
wear a
know.
mask. Okay.
Yeah, you just never, because we have patients who come in, we don't know if they're vaccinated or not. So the guidelines have been, if you, like the CDC has said, if you're around vaccinated people, it's okay, which is good for us because, you know, we eat food in our offices and we sit right next to each other, so it's not really a whole lot of space. And that's kind of how it's spread a lot in the hospitals and nursing homes, because it's like at some point you got to eat, you got to drink, and you're all enclosed, you know.
But you said you guys still wear masks when you're not eating.
No, yeah, we're still wearing masks. I
Okay,
still
all right.
wear masks and eye protection. So a lot of people still are wearing face shields.
Oh, okay.
So
Okay.
yeah, so we're still wearing them like to do our visits.
Okay.
But yeah, like when I'm around people who've been vaccinated, I'll necessarily wear them. But I still don't really go a whole lot of places. I mean, I know some people have been kind of just getting back to life as usual, but
Mhm.
I've mostly just been home still.
I think the vaccination kind of like, I
My
look at
cat
it like,
decided she wanted to join us.
yeah, chime on in, yeah. I look at it as like, they talk about, having beer muscles. Sometimes when guys drink, people get false sense of confidence.
Right.
And I think a lot of times when people get vaccinated, they go around. And I talked to a guy yesterday. He said, I don't have to wear a mask anymore. I'm vaccinated.
Right.
I can't catch it. But
Well, I mean, the
you-
number is 5%. So there's a 5% chance that you can still get it. So it's 95% chance that you won't, but it's still a 5% chance. So it's definitely lower. So I would rather people, you know, get the vaccine and then feel like they can go do stuff than just go, because there's plenty of people who are just going to do stuff because they feel like, well, people aren't dying as much. So
and if you're gonna be around people, you probably should still wear a mask, right? I mean,
yeah, exactly. Yep.
I see you brought my granddaughter in.
She brought herself. She don't ever come here. That's weird.
Hey, Dr. Shomo, can animals get the virus?
Yes.
That was one of the things that they were asking early on, but
no, the other Dr. Shomo.
The real Dr. Shomo.
Other.
So you know what's interesting? They were talking about like, rats and different things and animals, and cats eat rats and this and thing, so I'm wondering if animals could get it,
Well, that was one of the things that came out early on. They were wondering about like dogs and that sort of thing. But as far as we know,
there was a story where a cat had it,
Well,
yeah.
the cats and dogs can get it and they lick people, you wonder.
Well, that's
right.
I'll vaccinate your dog for $1,000.
I think that the biggest thing is whether or not it's like harmful to them, like if they're gonna die or anything like that.
Yeah.
And I think that from what they know, the answer is no.
But that was the same thing with the AIDS virus, which came from the monkeys, but
No, that theory was refuted, I think, by some Japanese doctor. They said it didn't come from the monkeys.
Well, the thing is that I knew a doctor that came from Africa when I was working at University Hospital, Dr. Nyendo, and he brought baboons here to research, and he had to oversee the treatment of the baboons, and that's what he called them, baboons. And and he told me that they have the AIDS and stuff, and I know there's other things that's saying that it really didn't affect them. But I know there's other things where people have said that it was developed, AIDS was developed for viral warfare or chemical warfare.
Yeah, people said the same thing about this, like if there was a lab. So I mean, I looked into it. I was like, but from what they know, it was
Came from bats, huh?
Yeah, it came from bats. So it's what we call like a zoonotic virus, and that's the whole thing. Like when SARS happened, and I think even Ebola, it just depends on the host. I think that a lot of the other zoonotic illnesses like SARS and a lot of I think even the swine flu, they had to have like an intermediate host where it didn't jump directly from like swine. Like you had to basically like eat the swine or that sort of thing. So, but that's been the issue with this, is it's been able to jump directly from the bats to us.
Right.
That's not a usual thing.
Okay.
And my cat won't give up.
Before we close, where do you see us going from here?
I mean, I think from here we just have to.
What would you suggest that we do as a society to try to get ahead of this the next time it happens?
Vaccination.
I mean, right now we have to focus on vaccination. We really need to get these vaccination numbers up because people are going to continue to die and have, because there's a lot of young people who are getting it now, which means that there could be a lot of young people who have heart and lung disease chronically for years and years. That, this virus is really going to affect us for generations of people who aren't able to work, who have disability because of, the effects. So just trying to encourage young people in your family to get the vaccine, and even everybody to get the vaccine. Like I said, the Pfizer and Moderna have been out for 6 months or so. I'm trying to think. They came out in November. I got mine. They came out at the beginning of December.
Right after the election.
Yeah, so it's been 6 months.
Because remember, Trump was mad.
Right. Yeah. Exactly. So they came out. They came out in December. We're in May now. It's been what, 5 months? I guess that's like 6 months, all right. All of April, all of December. So it's been 6 months now that we've had the vaccine. So I think that people are still hesitant, but it's just like, I don't know what more you need than 6 months to know that it's doing okay. That's quite a long time. That's quite a lot of data that we have now about it. Millions of people have been vaccinated. So I think that, we just need more people to get off the sidelines and get the vaccine so that we can get it still under control, because there's still people dying. There's still people being affected.
I think a lot of people, go ahead, Mike, go ahead.
What my theory is looking at what it is. And like I said, I'm not a genius and I'm not I'm not a scientist or anything, but it seems to me that we really can't really relax until we get about 75, 80% of our population, vaccinated, because
Right.
it seems that way, the numbers will really start to decrease. People say, well, we at like 40 or something like that, but I think the numbers have to go up to 70 to about 80.
At least 60. If we can at least get 2/3 of people vaccinated,
Right.
that would be great. So we're still working on that. And like I said, I mean, it's just one of those things. We have 6 months of data. Things have been going fine. So I want people to go ahead and do that. And then the other thing, as far as like in the future, how can we prevent this? I think that we need a national health system
Policy.
that's not like state by state based. We need an actual federal healthcare plan,
Which would
so
have
that we
some
can
federal
get on the same
guidelines
page.
Right. And a playbook.
Right. I mean, and that's the other thing. Trump like dissembled, like there actually was a pandemic team that Obama had created for this purpose. but so of course reinstating that would be one thing, but it's one thing to have a bunch of people in the White House creating plans. It's a whole other thing to be able to implement it on the ground. So I think that, we definitely need like socialized medicine, so that, because the other part of why a lot of people died during this pandemic was that just in general, a lot of people are not healthy. Most of the people who have been affected have been overweight, diabetes that they didn't even necessarily even know about. So just our general health status in America, a baseline is not the greatest. So we need a lot of public health interventions just to get our health better in general. We need socialized medicine so that people can have access to making sure that they're, if they have diabetes and high blood pressure, they can be controlled. Asthma, they can be controlled before something like this happens. And then we just need like a actual federal network to be able to just get in there and do what needs to be done if we ever encounter something like this.
I think what would be helpful too. I talked to a gentleman. He said, Robert said, let me ask you something. He said, do you know anybody that actually had the virus? I said, yeah, I know a lot of people. He said, I don't know anybody that had the virus. And I think to him, and maybe a lot of people like him, it hadn't really hit home. So maybe we need to have like a scared straight program, like let them see how some of these people suffer in these hospitals and what it does to them.
And I think that's one of the biggest things is like, because of HIPAA, we can't just go around showing people what's happening.
Yeah.
You know what I mean?
A lot of people don't believe, he still doesn't believe this is a real deal,
Well, I saw a story on the news, and they had a lady, and she was dying from COVID. She was dying from it. And she was still saying that, that it was
it's
a
not
Democrat.
real. How could I be dying from COVID? It's not even real.
That's right. And she died. You know what I'm just saying? And she died still believing that it was a hoax.
Yeah.
Yeah.
I said, okay, then what did she think she had?
Yeah.
It's just it's been a lot of propaganda and it's just been an interesting time to be alive, really. I'm happy to be alive and that we all made it, but it's just been interesting to see it all play out. Like I'm sure, like I said, they're gonna be like 100. There's gonna probably be like 100,000 books that are written about this time in all the languages, just because it's just been a really interesting time to be alive.
Yeah, but it was. I saw a good cartoon the other day. It was about the caption was "We're a special kind of stupid," and you saw people in the airport that were standing 6 feet behind each other going through the line. But then when they got on a plane, they were 4 abreast, like 6 inches from.
Well, I think it's 3 feet now though. They changed it to 3 feet.
3 feet, yeah. But
India is catching it.
oh man, that's a whole different show. There.
That's a whole different show.
Yeah.
Shomo, Dr. Shomo.
Dr. Shomo. Well, hey, once again, we wanna thank you for your time and your expertise. It's invaluable, and I'm sure we'll probably have some more people to reach out to us and say, well, after hearing Dr. Shomo, I decided that maybe I should take the vaccine.
Yeah.
Burrow, you want to close us out? Any closing thoughts?
Yeah, I was just wondering, so you were saying that pre-existing conditions such as high blood pressure, overweight, diabetes, I guess if you're a smoker too, and then you get COVID, it can ravage you much more than, say, a person of normal weight, normal blood pressure, and who hadn't smoked or anything?
Yeah, that is true. But at the same time, you never know. Like there's been plenty of people who've been healthy and also have been affected. So there's always risk stratification. People who are higher risk, like the people in nursing homes have been higher risk. So I think that the last time I looked at the numbers in Ohio, I think it was like 18,000 people who had died. And that was one of the things that I hated early on. Like they were just like, well, it's only old people. And I'm like, first of all, old people matter. I'm a geriatrician. So I'm just like, that's somebody's grandmother, brother,
Right.
sister, you know what I mean? So, but then if you look at the numbers and break them down by age, I think it was like 50% of the people were over, I think 60, but that means half of them were younger than that. So I think that, like I said, with data, you can always make it tell whatever story you're trying to tell. So there's been plenty of people in there. Like I remember when my husband and I were on call at the previous job where I worked, my husband was on call early on, like in March.
Also.
Yeah, my husband's also a doctor. So he was on call, and he got a phone call that a 40-year-old had died of COVID. So like last March, 40-year-old person, I think they had a history of asthma, but a lot of people have asthma. 40-year-old person with asthma dead. So
Wow.
I mean, for us, it was always real. Like it was always real. We had patients who were dying from it. We had colleagues who got it in the ICU. We literally wrote our wills. We wrote our wills, made sure we had our healthcare power of attorney paperwork together in case, we wrote our financial wills and we did our living wills and healthcare power of attorney paperwork, which I would still encourage anybody to do if you haven't done that before.
Yeah, my wife wrote my will. If something happens to me, she gets everything. It's pretty simple and straightforward.
I'm talking about two different things. There's a financial will. But then there's also a living will, which would be like, if you were ever on a ventilator, what would you want people to do? Would you want to be a vegetable forever, or would you want them to?
And if y'all need that, I could send y'all a copy of that.
Yeah, because I definitely sent a copy to my dad and make sure he got it. I think before this even happened, because we were dealing with a different situation. Okay. But it's just, there's a lot of tough conversations that should happen just in the meantime. But it's always been real for us. Like we've never been not able to look away. There's a lot of people who've been able to look away, but as physicians,
right.
we've had to face it from the beginning.
Well, we want to thank you, not just for coming, but for your dedication, because what you do is a labor of love. I mean, it's really, there's not enough money in the world to pay somebody to put their own life on the line to help someone they don't even know.
And so she's on the front lines too.
Yeah, on the front line, so we, you kind of like a guy that walks point in cavalry in the, in the army, he's the first guy out there.
Yeah, we really have been.
Yeah.
It's been a hard time to be a physician. That's another thing that I talked about on the last show. It's just been rough because, we risk our lives a lot, and then people still try to question why we do what we do.
Because I was telling your dad, that you've been so dedicated, done such a good job that he should give all of us a free German chocolate cake. celebrate.
should give me a German chocolate cake. You didn't make me one this year.
That's her favorite. That's her favorite too. See?
That's my favorite,
Yeah, that's
man.
my favorite.
I have one, and my wife won't let me bring another one in the house because I probably ate half of
I
it.
can't
So
go down.
I have to sneak it in. I have to sneak it in, man.
I can't go down to Cincinnati unless I got a German cake with me. But Anisha, could you tell us, about your platform and how people can see more of you?
So I have two different platforms now. So I have Dr. Shomo Knows, which is up here. So Dr. Shomo, like my name, Knows. And I have a website called drshomoKnows.com. And you can go there and you can find my Facebook, you can find my Instagram there. And I do a lot of different things. So part of what I've done too is, it's been a hard time for everybody like coping. So I've been doing yoga. I've been making playlists that people can just listen to even if they don't want to do the yoga. So like short playlists that you can use to go to sleep with because they kind of slow. So I've been doing a lot of things to kind of just spread love in general because it's just been a hard time. But I also generally will go live for Talk Tuesday to give updates about the pandemic, to talk about other stuff. Like the last time I gave a Talk Tuesday, I talked about alcoholism. Alcoholism has been really, really been a big problem during the pandemic. So I use that platform for more like my doctor role. And then I have a new platform called Health is Love, where I just talk a lot about like healthy coping. So I write for the Cincinnati Herald about self-care and beauty, um, how to basically be healthy while you try to be beautiful. And then I have a podcast called Health is Love, where I just talk about trauma and coping. So I just do a lot of different things.
Okay. Well, and you practice medicine, which
Yeah, and I take care of my patients.
on the side.
Yeah, I take care of my patients too, all day, every day.
Yeah. Okay. Well, our time is up, but we thank you for yours, and thank you for joining us.
Thank you for having
It's
me.
been a very, very informative show, and we reserve the right to call you back. Not next month, but sometime in the near future.
Yeah, it'll be easier because I just changed my schedule because I used to work all day on Mondays, so now
Okay.
I get off early on Mondays now. So
Okay. All right. Okay. And then maybe eventually we'll get those German chocolate cakes. Who knows?
yes.
Okay.
If
All
people
right.
just out in the world want to just like mail chocolate cakes to my office too, no. I'm just joking.
Only thing is wait that these people be throwing packages and stuff. Man.
But
Nah,
Mike, I
nah.
think you have your assignment.
We don't need that. We would all be obese and at risk of coronavirus. No.
Yeah.
Then we're gonna get diabetes.
Well, you know what I do when I eat a piece of cake and I go work out. I get on the bike for a half
No,
hour.
yeah, I work out all the time anyway.
But it doesn't really cancel it out. You know what I'm
No,
saying?
yeah, no. It's about balance. Like I eat sweets sometimes, but when I used to work in a nursing home, it was the worst. We would get all these sweets all the time. So it's just about, just that
Okay.
balance.
All right. Okay.
All right.
Well, thank you once again. And without further ado, everybody wear your mask. Have a great evening and stay safe. Bye now.
Bye.
Bye.